So interprofessional team, basically the interprofessional team contain the provider, they contain the occupational therapist, also included the social worker or speech language pathologist, right? So interprofessional team basically content or all of the provider, right? All of the provider I said. And here basically the provider, what are the most important for NCLEX board? The provider means the person who give the diagnosis or assess the, assess diagnosis and give the treatment, right? And provide the included the provider including medical doctors or orthopathy, advanced practical nurse is called APN, or physical assistant, right? So all MD, DO, or nurse practitioner, physical assistant are the provider, healthcare provider. So provider or healthcare provider is the member of interprofessional team, right? So also the interprofessional team also consists of occupational therapist. So occupational therapists basically help the patient to regain their ability to perform their daily living activities. So if patients are not able to continue their activities, activities of the daily living, shortly called ADL. So you or occupational therapist can help them to adapt with their abilities, activities of daily living. We encourage the patient, right? Encourage the patient to participate in daily living activities. Example of when to refer, a client has difficulties of using eating, right? So I said when you or any therapist can help them, but also try to motivate them to participate their daily living activities. Occupational therapy is a part of interprofessional team. Social worker. So social worker also important member in the interprofessional team. Social worker, as I told you, social worker basically identify or coordinate the community resources and other patient need necessary for discharge or recovery. Social worker, I said. Um, social worker works with the client or families by coordinating in patient and also community resources to meet the psychological or environmental needs. Like a patient is diagnosed by a bipolar disorder, go to hospital, you give the treatment, the time will come for discharge. When you discharging them, you educate them. Same time, you have to tell them some social worker contact email or website or phone number. They can give them more information, or they can give them the link to communicate with other person in a group. because group working or milieu therapy sometimes help to healing some chronic disease, right? Social worker. And also the speech language pathologist. So imagine a patient has a difficulties of speech or language. That times we have to have the speech language pathologist can help to the patient to to solve their problem. So assess the patient and also any kind of issue related to speech or language, or even swallowing. This person, the speech language pathologist can help. So evaluate and make the recommendation regarding the impact of disorder or any kind of injuries on speech, language, or swallowing. Teach the technique and exercise to improve their function. So, interprofessional team, as I told you, consists of provider, healthcare provider, occupational therapist, social worker, and speech language pathologist. So in this